Um, Currently, it does not require us to put that on the end of the IV tubing. If that ever changes, Jerry or myself will let you guys know. But currently, that is not our process, and we won't be doing a lot of IV bags. Another change, PPE going into our negative pressure room. Currently, some of you may have done this when you've gone in there, but it is a change, and I want you to pay attention to this because it is something that could be asked of you of a surveyor. At this training I'm currently at, someone did say, when Joint Commission came to their site a few months ago, they asked what they did different. So just have those little caveats in the back of your mind. It's something that could be asked. So when you're going in there, you need your head or beard cover, just like normal, your mask, just like normal. You need 2 pairs of shoe covers, 2 pairs. And then when you're compounding, you need 2 pairs of gloves. If you ever get asked if our gloves meet the ASTM rated standards, every single box of gloves in our hospital, sterile and non-sterile, meets these requirements. So you should not ever have to worry about that. What you do need to worry about is if you're going in there to compound, you need 2 pairs of shoe covers and 2 pairs of gloves. And then you need a gown as well. And our gowns meet the requirements as well. Doffing. So this is also different. While some of us are used to taking things off in the ante room, some of us are used to, wear stuff out and we take it off and blah, blah, blah. This is different. So you have to remove these items in a certain sequence and place them in the yellow bin prior to leaving the chemo room. Okay? You will remove some gloves prior to leaving the room. So before you get into the ante room. So remember, you have 2 pairs of gloves on. So first, you're going to remove that outer pair of gloves, which they deem, as the most soiled item that you have on. Then you will remove your shoe covers. Then you will remove your gown. And then you will remove your inner gloves. All of that goes into the yellow bins in our chemo room. This is something, when you're putting in our chemo room, I currently have 2 bins. I have a top little smaller bin. I would like you guys to put the, like if you have any needles or syringes, something like that, in that bin. And then in the big bin, I would like your PPE to go in there. Technically, they can go in either or, but if someone were to push down on all these gowns, if we get to where we pound more, I wouldn't want them to accidentally, push down that needle. So just for our safety, use the bigger bins for all of our PPE and use that smaller bin for our sharps, if you can remember. And then when you get into the ante room, make sure you perform hand hygiene. So you also would need to wash your hands and everything before you come out of the hood. Where's everything you need? So all of our methotrexate vials, currently 2 ml vials are stored in the negative pressure room. That is a requirement of USP 100 because they have to be stored in negative pressure room, and that is the only area that we have in our pharmacy department that is negative pressure. So all the methotrexate is in that room. So also, to compound that, you have to go in there. The chemo room is also stocked with all the closed system transferred components and that you would need for an IM injection. I do not have the IV spike back infusion adapters in there yet, but I will stock those in there. There are also laminated sheets or instruction sheets that if you get in there and you're like, oh no, I forgot what stuff I need to do, they're in there for you to use. So those are there. I plan on printing out some for the infusion adapters as well and putting that in there. The chemo room is also stocked with a 22 gauge 1.5 inch needle that the OB staff requested for the final preparation of their syringes. If any of these ever get low, or I didn't know that someone did methotrexate, so I didn't restock the kits or anything in there, please, please, please let me know or restock those yourself. We have all of the supplies in the pharmacy, or we should. Additional supplies are located in the top shelf of the cabinet labeled CST supplies. It's pretty much right outside when you come out of the ante room. You open up that cabinet, the top shelf has all of our in-date items. That middle shelf, I put a sticker note on it, but those are all of our demo products. So those are all things that have expired that you can use to try these on and practice. But that top shelf should be everything that is in date and still good to use. I've made a USP 800 Teams file page. All of our resources for compounding are on there. I'm going to put this video on there. I'm going to put these slides on there. I already told you guys everything else is on there for the competency exam I sent out earlier this month. I just talked about this, but demos. So we have some expired things that you can use for trainers. I've written trainer on there. You can utilize 2 ml vials of lidocaine, 1%. If we do not have any, we just have 2 ml vials of sodium chloride. If we have that, prefer to use that, but you can use the lidocaine for your practice for the IM injections if you would like. You can use bags of normal saline if you like to practice on an IV bag. If you can't find a certain product, you have questions, please, please, please let me know. I'd rather you ask me questions than get in there and be completely oblivious to what's going on. So it's not something we're going to do very often, but it's something I want you to be aware of and be at least know where to find your resources if that order comes through and you need to make that. My references, if you even care about those. And that's it. So please let me know if you have any questions. Feel free anytime. But I do know this is going to be a hot topic coming up in, the upcoming surveys that we may have. So definitely have it high on your radar and know where to find everything if you are asked. So thank you. Let me know if you have any questions.